Today we are going to see anterior compartment of the leg. What are the structures in the anterior compartment of the leg and dorsum of the foot, right? First we reflect the skin. If you want to approach the anterior compartment of the leg, first you have to reflect the skin. Okay, this is the after reflecting skin you will get superficial fascia. Within the superficial fascia you will get fat. Next within the superficial fascia only you will get another important structure, that is in the, you see what you are seeing, this is the great saphenous vein. Great saphenous vein. Okay, this is the great saphenous vein. Where it starts from the dorsum of the foot, that is the dorsal venous arch. Okay, this is the dorsal venous arch. The medial end of the dorsal venous arch, it continues upwards in front of the medial malleolus, that is 1 inch or 2.5 centimeters in front of the medial malleolus. Then it continues as the great saphenous vein, right? That is one important structure. Here this is the dorsal venous arch. What you are seeing, this is the dorsal venous arch. This dorsal venous arch, it is formed by joining these dorsal veins, that is the proper distal veins. Together they form the common distal vein, and all common distal veins together they form the dorsal venous arch, right? This dorsal venous arch medial end contains as the great saphenous vein and lateral end contains as the short saphenous vein, right? That is the one important cutaneous structure. And next along with this great saphenous vein, you will also see this is the saphenous nerve. Saphenous nerve, it is a nerve of the, it is a branch from the, that is a femoral nerve, and it is the longest nerve in the body, cutaneous nerve in the body. Then it accompanies the great saphenous vein here. Then it supplies to the medial side of the, most medial side of the foot. Okay, this area of cutaneous nervation by the this saphenous nerve, right? These are the two most important structures you are supposed to appreciate in the dissection of the leg, right? Next here it is also having clinical importance. Here you see the great saphenous vein, and this is a very commonly used vein for venosection. Venosection means we used to cut the skin when we are unable to get the venous route to administer IV fluids. Then we deflect the skin first, then we tear the superficial fascia, then we approach the vein in living persons. Then we put a catheter into the, directly into the venous, this great saphenous vein, and this is the to save the life and to give IV fluids in emergency basis. Okay, that is why this great saphenous vein is clinically, it is very very important. The most important point you are supposed to remember here is, after entering, putting catheter into the great saphenous vein, we tie the vein, distal part of the vein. Okay, in that while tying this one, you are supposed to avoid including this the great saphenous vein in this tie. Okay, that is the another important clinical point you are supposed to remember, right? That is about the cutaneous structures in the anterior part of the leg.